Hi, my name is Janelle Wessels, and today I will be doing the NG Tube video insertion. So what I have with me today is my stethoscope to check for pH. I have my towel. Stethoscope is to check for placement of the NG tube once we insert it. I have my 60mm syringe. I have gloves, tape, my tube, some lubricating jelly. I also have a specimen container, and then I don't have any, but I'll be using this as a pH strip to check the gastric contents once I get to that part. And then I have my patient here. So first things first is I'm going to verify physician's orders, making sure that we have the correct orders in place to go ahead and do the NG tube. Okay, so I'm looking at the orders. Orders are in place. I'm gonna go ahead and knock on the door. So knock on the door, knock, knock. I'm gonna close the door, close the curtain behind me to maintain patient privacy. I'm going to introduce myself to the patient. Hi, my name is Janelle. I'll be your nurse today, and I'm going to go ahead and do the NG tube. Can you please tell me your name and date of birth? Patient's name is John Smith. Date of birth is 1/1/2001. Okay, perfect. I'm going to go ahead and check the patient's wristband, checking the two identifiers. They are who they say they are. So I'm just going to introduce again. Hi, John. So I'm going to be going ahead and inserting the NG tube for you. This is just your doctor put it in to help administer medications to you, okay? Okay. So first things first is I'm going to insert my tubing into the basin with water so that it's a little bit more easier to put in. And then I'm going to raise the bed. I'm going to position the patient in high Fowlers. And I'm going to go ahead and I can't think of the word, gel in or perform hand hygiene. I'm going to go ahead and put on my gloves. Sorry, it's a little tight. Sorry. Okay, I'm going to take my pen light, and I'm going to have John go ahead and tilt a little bit back. I'm just going to check your nasal passage. Okay, so both sides are free from abrasions. There's nothing occluding it, nothing like that. The septum is midline. I'm going to go ahead and just press on one side of your nostril. Go ahead and breathe out and let me breathe in and out. Okay. Breathe in and out on the other side. Perfect. So in this scenario, I'm going to go ahead and choose the left side as it's a little bit more stronger. Okay, so I'm going to go ahead and take my tube, and we're going to go ahead and measure. So I'm going to measure from the nose to the ear and then down to the xiphoid process. And it looks to be about 50. So I'm just going to take my tape and place it at the 50, so it kind of gives me like an indication of when to stop. Okay. Okay, so at this point, I'm going to go ahead and lubricate the tube with jelly. And I'm going to go ahead and insert it following the natural curvature of the tube. So I'm going to have them position their head up, go ahead and bend a little bit back, and I'm going to stick it in. So I'm going to go all the way down to, I said, about 50. And at this point, if they were gagging or they were having trouble, I would have them just try and swallow. I would even offer water at this point just to kind of help them. Of course, we're not met with any resistance. If we were, we would take the tube out and re-lubricate it and retry. So here we are about 50. I'm going to go ahead and just lightly tape it so that I can check the placement. Okay, so just lightly taping it. So at this point, I would get my 60 millimeter syringe. I'm going to go ahead and get back about 30. So you could check placement by pushing in about 30 milliliters of air, or 30 cc's of air, and then drawing back about 5 to 10 cc's of stomach content or gastric contents, as well as when you're pushing in the air, you're listening to the stomach and making sure that it's like a nice whooshing sound. So I will do both just for the contents of this video. Depending on what your doctor says, you can even check placement with an x-ray, but we'll get into that later. So I'm just going to put this and I'm going to push in about 30 cc's of air. Okay, I heard a whooshing sound. Now I'm going to draw back 5 to 10 of stomach contents. Okay. And I'm going to clamp that. Okay, so I'm going to whoosh this around. And I'm going to put it in my specimen jar. I'm going to take my pH stick, put it in there so that I can test the stomach contents. So stomach contents seem to be about 3, which indicates that we're in the correct placement. Had it been around anything over a 3.5, then we wouldn't have been in the correct placement. So we'd have to go ahead and do that. So I'm going to now tape it more securely. In the bridge of the nose. And then I'm going to, you would have the right tape for this, but I'll just make my own tape. Okay, perfect. Then you're going to go around. Oh my goodness, so Okay. And then you would safety pin it to the gown. However, we don't have safety pins. So it's safety pin to the gown. And then you're going to ask Mr. Smith, how are you feeling? Are you okay? Making sure that they're okay. So he's okay. I'm going to lower the head of the bed and then lower the bed to a more comfortable position. At this point, x-ray would come in and do an x-ray and verify that the tube is in the correct place, which it should be because we took the gastric contents. We're going to dispose of the gastric contents. You're going to maintain the patency of the lining, making sure that it's good, noting like any characteristics, if there is to be like any drainage, and then the amount of drainage. When you go to document, you're going to document the procedure, any care that was involved, how the patient responded, and any assessments that you did on the patient. And yeah, okay, Mr. Smith, well, that is everything. Thank you. You tolerated it very well. So you're gonna get rid of all your stuff. You would take off your gloves and dispose of them, perform hand hygiene, and see yourself out. Thank you.